Thank you, Senator Walsh. Senator Henderson.
Thank you very much, Madam Acting Deputy President. I rise to speak on the incredibly important issue of aged care, and it is with regret that I have to call out these very grubby tactics from Labor senators over the tragic issue of aged care deaths, including those people who have died from or with COVID-19. The Australian Government is determined to ensure a safe environment exists in aged care facilities as we work together to contain the spread of COVID-19. We offer our deep condolences to those families who have lost loved ones. But let's have a debate on facts. Let's not see Labor senators turn their backs on the facts. Across the country, 97% of aged care facilities have not had an outbreak of COVID-19, and that figure is 92% in Victoria. Since the beginning of the COVID-19 pandemic, the federal government has announced funding of an additional $1.5 billion in new measures to respond to the impacts of COVID-19 on aged care. The fact is that some 60,000 residents in aged care facilities die every year. It's a tragic statistic, but that is a fact. But what Labor is attempting to do is attribute the deaths of some 450 aged care residents and 7 home care residents to the minister. This is a disgraceful proposition and demonstrates how desperate the Labor Party has become. As I say, Labor has turned its back on the facts. First and foremost, here is a very critical fact in this debate. The Australian Government's role is to fund and regulate aged care, not to run aged care facilities. This is done by the state and territory governments, by private operators and not-for-profit operators such as churches. Where there are regulatory breaches, the Australian Government, through the Aged Care Quality and Safety Commission, comes down very heavily on the operator to ensure there is appropriate ramifications, remedies and accountability for such breaches. The Commission is taking, at the moment, a proportionate, risk-based approach in responding to the COVID-19 pandemic. Remember, this is unprecedented. The Commission continues to use the full range of its regulatory powers to ensure aged care consumers are safe and providers are delivering quality care and services consistent with the aged care quality standards. This is of particular importance in respect to the challenges created by the COVID-19 pandemic. If a provider is not meeting its legislative obligations, the Commission may take regulatory action, including imposing sanctions or issuing a notice to agree to certain requirements, called an NTA. The Commission has taken regulatory action during the pandemic in relation to services where there was a severe and immediate risk to care recipients due to the management of the outbreak. There have been 19 NTAs issued to providers since the beginning of the outbreak for this reason. 18 of these notices relate to residential services in Victoria, and 1 notice was issued to Anglicare New South Wales for Newmarch House, in New South Wales, of course. 1 NTA has been issued, however, the details of which have not yet been published. Information about these notices is published on My Aged Care after residents and relatives have been informed by the provider of the action taken by the Commission. So we need to have a brutally honest discussion about what is going on in aged care in this country at the moment as a result of the pandemic. Nearly all of the COVID-19 related deaths in aged care facilities have occurred in Victoria, and yet we have not seen that very important point been made by members opposite. So I just want to go through the numbers. And these are really tragic numbers, and again I reiterate my condolences to the families and friends of those who have died in aged care, including during this pandemic. And these, of course, relate to people who have died from or with COVID-19. 29 deaths in New South Wales, 0 in the ACT, 0 in the Northern Territory, 1 in Queensland, 0 in South Australia, 1 in Tasmania, and 419 in Victoria. 419 in Victoria. So let's just reiterate that our government is a national government. Our policies and our plans are enacted across the nation. Our policies and our management of aged care facilities is no different in Victoria, other than Victoria has received greater funding because of the pressure it has been under due to the number of deaths it has suffered. The difference in Victoria between what is happening in other states is the alarmingly high rate of community transmission, which has been caused principally because of the Victorian government's failure to manage the spread of coronavirus in Victoria. It is a grim fact, but it is not contestable, as we now know, due to the evidence that has been presented to the Coates Commission of Inquiry. The hotel quarantine disaster, to which nearly every active case can be linked, is one of the principal causes of why there is such high levels of community transmission in Victoria, which has invariably meant such high number of deaths proportionate to every other state and territory in the country. So if I look at the contribution of Senators Walsh and Siewert, I want to reiterate that our plan and our policies in terms of combating COVID-19 in aged care facilities have absolutely worked in states which have worked effectively to suppress the community transmission of coronavirus. And I think all senators across on the other side of this chamber well understand that, but they are not being honest about the facts. The other critical issue in Victoria is the mismanagement of contact tracing. Contact tracing in New South Wales, for instance, has been managed extremely well. Every outbreak, there's an identification of where it's happened, and there is enormous resources being placed into contact tracing in New South Wales. That's not the case in Victoria. There's a huge lack of resources, and there are literally thousands of mystery cases, so that there has been huge issues in identifying the source of the coronavirus and in suppressing the spread of community transmission. As the Treasurer has said today, this represents one of the worst public policy failures we have seen by any government in this nation. But the Morrison government continues to ensure and work very closely with the Victorian government and with all states and territories to suppress the spread of the coronavirus, including in aged care residential facilities. So we've initiated a number of important different initiatives to, of course, deal with the issue of the spread of coronavirus in aged care facilities. Of course, I've mentioned the $1.5 billion of additional funding, and another $500 million, just $500 million was announced today. The Victorian Aged Care Response Centre, which is actually a collective effort between the Commonwealth and the state to make sure that when there is an outbreak, that we can act urgently to address it. Massive support from the National Medical Stockpile, including the supply of some 14 million masks and 3 million gowns. Immediate support from the wonderful members of the Australian Defence Force and AUSMAT personnel, personnel who are being dispatched urgently to facilities which need that help. Of course, as soon as there is an outbreak in an aged care centre, the workforce, anyone who comes into contact with the coronavirus, has got to isolate for at least 14 days, and that's why the response from ADF personnel has been so magnificent. And of course, the other really significant thing that's happened in Victoria is that we've intervened. The Commonwealth has intervened to ensure that anyone in aged care who needs hospitalisation is immediately transferred to hospital. That was not happening, and that was deeply, deeply concerning. And we have now worked with the Victorian government to ensure that those defects in people who needed hospitalisation not being sent to hospital, that is now being remedied. And of course, we're also working very hard with infection control and compliance spot checks. We as a government will continue to work with the Victorian government to manage the spread of COVID-19 in Victoria, but I think it is fair to say that Australians understand why there is such a major pressure in Victoria, and I absolutely condemn senators opposite for the very wrong implications they've made in relation to the minister. Thank you.